Meanwhile, New Zealand has its first case of monkeypox, and health authorities say we can expect to see more in the coming months. The infected person is isolating in Auckland, having recently returned from overseas. Lucy Thompson has more.
Monkeypox has officially touched down in New Zealand. Our first case was detected by way of a PCR test yesterday, after the person in their 30s returned home from a country with the disease.
The number is now around 9,000 cases internationally, 20 cases detected in Australia. It was just a matter of time before we saw a case in New Zealand.
And while a very small number of contacts have been asked to monitor for symptoms, such as a rash, fever and body aches, experts say there's no need to worry.
I mean, this is an infection that's spread by quite close contact, often direct physical contact with someone who is infectious. I mean, the key defining moment for New Zealand would be if we saw local transmission on any scale. And I think that's easily managed.
Officials are expecting more cases to cross the border in the coming months, but are confident they're prepared for their arrival. Last month, monkeypox was officially listed as a notifiable disease, enabling authorities to access tools needed to contain the spread.
Once we have a case that's diagnosed, then our public health units step into gear around contact tracing and providing support to both the case and the contacts.
Meanwhile, the Ministry of Health is working with Pharmac to explore options around vaccines.
We do know that the smallpox vaccines historically have some protection against monkeypox as well, so that's what we are looking at.
With monkeypox now reaching more than 50 countries and case numbers in Europe tripling in recent weeks, the World Health Organization is set to reassess the virus's global health risk next week. Lucy Thompson, Newshub.